Hello everyone, thank you so much for tuning into my presentation. Today I'll be presenting on autism spectrum disorder in adult women and its impacts on personal identity. In this presentation, I will be using identity first language, such as autistic person, as from what I have found, this is the preference of a majority of autistic people. I will also be exploring autism that is not co-occurring with intellectual disabilities. These are the topics we'll be going through today. Who are you? Why are you here? What is your purpose? These are all questions that relate back to self-identity. Who are you fundamentally? How do you relate to others in the world? Discovering who you are is deeper than your job, your nationality, family ties, and hobbies. It can be a long process and it takes active work in reflecting inward and discovering your true morals and values. These questions are difficult to answer, even with years of work. So, who am I? Well, my name is Leah. I'm a 24-year-old Canadian woman. I'm a student. I went to the University of Calgary and got my Bachelor of Science in Anthropology. I'm now completing my Master of Arts in Counselling Psychology with Yorkville University. But who really am I? Why am I here? What is my purpose? What is my identity? These are a lot harder to answer. What is identity? We live in a social world, and as humans, we can feel defined by our relationships with other people. But your identity goes deeper than this. Your identity can be defined as your beliefs of who you are, your personality, your interests, and your morals. What is autism? For definitions and diagnostic criteria, I referred to the DSM-5. So autism is described as including these criteria. The first is persistent deficits in social communication and social interactions. This includes deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors such as issues with eye contact, or even a total lack of facial expressions and nonverbal communication. It also includes deficits in developing, maintaining, and understanding relationships. Next is restricted and repetitive patterns of behavior, interests, or activities. This refers to stereotypical repetitive motor movements like flapping or bouncing, inflexible adherence to routine, and ritualized behaviors and ritualized patterns of verbal and nonverbal behavior. This also includes symptoms like sensitivity to tastes, textures, fabrics, and other sensations that would likely go unnoticed to a neurotypical person. And then symptoms must be present in the early developmental period, aka childhood. Symptoms must cause clinically significant impairments in social, occupational, or other important areas of functioning, and these symptoms cannot be better explained by intellectual disability or global developmental delay. When asked, who am I? Maybe I would think a bit harder. I'm a sister, I'm a daughter, I love my family, I'm a girlfriend, a cat mom, and a friend. Now, what do all these things have in common? They're all based on my social relationships. A lot of our identity is placed on how we think others feel about us and how secure we feel in our relationships. For some people, this entire part of the equation is different. Navigating the intricacies of social relationships is a challenge for us all. It can be especially so for people on the autism spectrum. For autistic women in particular, social situations are complicated and confusing, but they still crave social connection. Understanding the importance of social relationships, while also understanding the difficulties that understanding the importance of understanding the importance of social relationships while also understanding the difficulties that autistic women face with social relationships is really important in understanding how autistic women experience their identity. Their social naivety puts them at greater risk for exploitation in both platonic and romantic relationships. and autistic women can prefer one-on-one social interactions or having a single close friendship, but they may obsess over this one friend. Social anxiety is common for autistic women, and socializing can be overwhelming, and they'll need more time than most to recover from social situations. Autistic women can also get bored or uninterested in casual conversation, small talk, or gossip, not because they feel superiority or don't care about others, but it's difficult for an autistic woman to engage in conversation without a function to it, or they just don't understand social cues, sarcasm, jokes, or other things happening in the conversation. It is well known that autism is more frequently diagnosed in boys than girls. For a long time, the discourse around this was that it was just more common in boys. I used to think this too. We now know that it is not only that girls are less likely to have autism, but just that they are now more likely to receive late diagnoses well into adulthood or never receive a diagnosis at all. Diagnostic criteria such as the ADOS were originally created with and for autistic boys, so even if a girl does get an assessment, the materials may not find anything. Most research until very recently has been done with boys, and it has not been until recently that girls have begun receiving attention. It is unknown exactly what the ratio is for boys to girls with autism. Many studies have shown that approximately 4 boys have autism for every 1 girl. However, when only studies that actually evaluated participants for autism were included, and studies of autistic people with previous diagnoses were excluded, this number drops to 3 boys for every 1 girl. This indicates there are autistic girls and women out there who are either being misdiagnosed or never getting assessments completed in the first place. So it is well documented that girls and women are underrepresented and underdiagnosed. So how is it possible that they continue to go so unnoticed? There are 2 leading hypotheses for why women often don't even know themselves that they could have autism, let alone receive a formal diagnosis and proper treatment. These 2 hypotheses are not mutually exclusive and are likely both large influences. The first I will cover is the female autism phenotype hypothesis. This hypothesis suggests that females experience and present their autistic symptoms in a completely different way from autistic males. The second hypothesis is the camouflage hypothesis. Camouflaging is well documented in both men and women with autism, though it is more common in women and can sort of hide their autistic traits. This can seem advantageous in some scenarios, but is thought to be one of the causes for women being underdiagnosed. Autistic women are unique from autistic men in many ways. Autistic women are often shunned from professionals because they care about friendships, whereas an autistic boy would just love to be alone. Autistic women are different and crave social connection, so much so that they'll change how they act, speak, or they'll even stay in abusive relationships just to connect with others. Autistic women are also less likely to present stimming actions, think flapping and bouncing. Social exhaustion is common, and autistic women can have a history of being unable to stay with a stable job, sometimes from being unable to cope with the loud and hectic nature of the environment, can miss work from social exhaustion, or simply find work too stressful and frustrating. When one thinks of restrictive and repetitive behaviors and interests, I, for one, immediately thought of a small boy lining up his trains and counting them. Many times these interests in girls and women are seen as normal, and that the girl is just quiet and shy. Many girls share accounts of reading so many books and becoming so involved in their stories that it was all they cared about, but they're just labeled bookworms. From both personal experiences working in an office that provided autism assessments, as well as from the research I've done, it can be hard to identify girls and women with autism because they just don't behave like autistic boys. Camouflage or masking describes the actions that autistic people take to hide their autistic traits. This can be as subtle as forcing themselves to make eye contact, reminding themselves to smile during a conversation, or rehearsing lines and phrases in the mirror that maybe don't even make that much sense to them, but they can use them in conversation. Camouflaging at first glance may seem a bit helpful. Autistic women can use these tricks to engage in conversation, get along with coworkers or friends, and pass their life with nobody knowing that they're neurodivergent. But sadly, it isn't this easy. Camouflage is hard. It's a constant charade of checking, rechecking, focusing on everything while trying to block out external stimulus, managing your verbal and nonverbal body language, all while trying to understand what others are communicating to you. It's exhausting and hard, and it can be lonely. These are important themes in the research surrounding autism in women and how it impacts them on an internal level. These women grow up feeling like nobody really knows them for the real them, their real identity. And most of the time, it's hard for autistic women to even have a chance to know these things about themselves. A 2019 study found that the most common reason for camouflaging is to fit in and pass in a neurotypical world. So women camouflage their autistic traits to not be seen as different or to fit into non-autistic social groups. Women share their feelings that society is designed for neurotypical people, and to get through situations, they have to act different from their true selves. Another reason is to avoid retaliation and bullying. In this case, camouflage is used to keep a feeling of safety and protection. Many participants share that this response is not only to prevent bullying and mocking, but it is responsive to their common experience of being bullied in the past when they weren't camouflaging. The third most common reason was concern about impressions made when not camouflaging. This means autistic women camouflage their autistic traits so as to kind of control how others see them, and to create an image of themselves to others that fit with what the autistic girls think others would like and be comfortable around. Some women also reported camouflaging simply out of habit, that it had become a natural response to act differently in social situations. Now, this doesn't only impact young 20-something-year-old girls who are confused about their identity. This concern goes deeper, and the need or desire or defense mechanism of camouflage is shared by so many autistic women. This includes parents who act different so as to not embarrass their children or to look competent for teachers and other parents, or it can be for partners not wanting to embarrass their significant other in public or trying to act as the perfect girlfriend. Autistic women even share shame in their identity, camouflaging to avoid this feeling of shame, or because they feel that just being them isn't good enough. A study completed in 2019 with 262 autistic adults found that no matter whether they were camouflaging a small amount of the time to all of the time, they still showed elevated levels of stress and anxiety. Despite camouflaging being associated with higher suicidal thoughts, it was not in this study found to have a large impact on depression. It should be noted that the mean for depression in the group was higher than that for the general population. Autistic women often feel like they don't fit in typical gender roles, but they'll camouflage and they'll build these lives for themselves as a wife or a girlfriend or a mother in an attempt to fit in. This article also shed light on the double empathy problem. This is where autistic people struggle to understand the neurotypical world, as well as neurotypical people struggle to understand autistic people and their sociality. This means autistic people spend a significant amount of time and energy trying to fit in and understand a world that wasn't designed for them. And this toll can be exhausting, draining, and just really uncomfortable. When autism is diagnosed and treated early in life, those affected can show serious improvements and live a beautiful, fulfilling life. This is why it's so important for professionals to continue to investigate and learn about women with autism. With diagnoses, girls and women can get the help they need, the resources, and they can find social circles that allow them to express themselves, such as clubs dedicated to their special interests or groups with other autistic women. Learning more about the female autism phenotype can help with diagnosis, but furthermore, identifying and helping these women from a young age can help prevent the need to camouflage and can hopefully reduce the harmful costs that these women are burdened with when forced to hide their true selves and their true identity. Thank you. Any questions?